Our project deals with predicting respiratory health risks for agricultural pesticide exposure. Agricultural pesticide use varies by crop and region and may contribute to localized increases in asthma and COPD. Public health agencies need data-driven tools to target preventable interventions, such as integrated pest management, under constrained budgets. Therefore, our goal is to build a county-level predictive risk model that will identify U.S. regions where pesticide exposure is associated with elevated healthcare burden. Real-world stakeholders include insurers, policymakers, hospital systems, and public health departments. Our project combines three datasets from 2018 and 2019, giving 12,000 data points and 447 features, 400 of which were pesticides.
We explored our combined dataset with a cross-correlation heat map between the numeric predictors and found some notable correlations between them, such as a negative correlation between the median income and obesity and diabetes prevalence, and the positive correlation between cropland acres and total pesticide use. To handle these collinearities, we used regularization techniques in our modeling. Next, we explored regional patterns in our dataset. Notably, we saw heterogeneity in these distributions where counties with high pesticide use could have either high or low population. Based on this, we normalized the pesticide usage to better capture the intensity of pesticide in a given county. In addition, the prevalences of asthma and COPD, our target variables, were not normally distributed, and thus we decided to stratify on the bin target variables when splitting our data into train and test sets.
Our dataset includes estimates in raw kilograms by compound. This is highly skewed by large counties, and true exposure risk is not immediately captured. To remedy this, we developed two pesticide intensity metrics, pesticide per capita and pesticide per acre of cropland. To these, we applied a log transform to further reduce skew. Similar feature engineering was applied to demographic, health, and cropland features as well. When trying to develop a predictive risk model for respiratory illness, certain features seem natural. Think, for example, smoking rates, virality, demographics, income, etc. It's reasonable to ask whether pesticide data would have a significant impact on the models. To address this, we performed hypothesis tests for different nested models, including nested linear models, and found that pesticides resulted in a statistically significant improvement over baseline.
For our model selection pipeline, we fit 56 models, 7 model families across those 4 exposure sets for both asthma and COPD. The pipeline starts simple, a single feature baseline, and builds up to a tuned XGBoost. We chose linear models for more interval coefficients and hypothesis testing, and XGBoost because it typically gives the best predictive performance. And we see exactly that. Model comparison results for asthma show that XGBoost outperforms all linear models by about 25%, and results are consistent regardless of exposure set. The same pattern holds for COPD, but this time by about 13%, and here exposure set differences are even smaller. So which features are most important? For both asthma and COPD, smoking was the most important feature, but the bin pesticide features such as chlorophenoxy and anialide were meaningfully mid-ranking. For COPD, pesticide features barely register. Lastly, when modeling without binning pesticide class, results in pesticide features gaining importance.
Is our model performing equitably across groups? So geographically and in income and rural urban groups, there aren't clusters of error plainly visible. However, we did observe error is highest in majority BIPOC counties, which has implications for environmental justice. So going forward, improving equity might mean better data coverage and targeted modeling for these groups. We asked 3 questions. Does pesticide data help? What model works best? And does performance generalize? So first, yes, pesticide data improves predictions. There's real environmental signal there. Second, XGBoost with raw pesticide features perform best out of the models tested. And third, the model generalizes well. From a equity lens, errors are stable across income and geography, but there is higher errors in majority BIPOC counties, something to keep in mind when interpreting and using this model. So no model's perfect. This is observational only and temporally limited, and uses modeled health outcomes. So future improvements include expanding pesticide reporting, adding time dynamics for better health data, and incorporating policy and prevention signals like integrated pest management and case law. This web app makes it actionable. Users can explore counties, download data, and access policy resources on our web app. We hope this tool helps inform decision makers and to inform policy and practice.